We have all seen medical illustrations in doctor's offices or even hospital waiting rooms, but have you ever seen an illustration featuring a Black person? Go ahead, think about it. I'll wait. I'll wait a couple of seconds for you to give that some thought. The answer, though, is probably no, because more than 95% of all medical illustrations depict white bodies, particularly white male bodies. My guests today have reasons, have answers, have explanations for why that is. All coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
Last month, an illustration of a pregnant Black woman went viral on Twitter and other social media sites. Millions of people saw for the first time a depiction of a Black fetus, and the response was overwhelming for a future Nigerian medical student and illustrator who had no idea that so many Black people had never seen a Black fetus or a Black pregnant woman depicted in mainstream media. This young artist had no idea that his photo would open the floodgates for a long overdue discussion on why only whiteness is depicted in medical books and images of bodies used in the medical profession. Now, medical illustration was established around the 19th century, but since its inception, the field has remained predominantly white, and so has most of the illustrations it has produced. In 2018, a professional organization of medical illustrators launched a diversity committee to push its members to include more variations in their work. As they noted, the lack of diversity has a profound impact on patient care. It fosters medical discrimination, and some say it even perpetuates the myth of white superiority. Here for my leadoff discussion is Dr. Deirdre Owens. She is a historian and director of humanities in medicine at the University of Nebraska-Lincoln. Good morning and welcome back to the show, Dr. Owens.
Good morning. Thank you for having me.
You know, I just want to get your reaction when you saw that viral fetus, that Black illustration that went viral. What was your first impression?
My first impression was actually shock. It's something that I kind of took for granted that Black people would be represented. And in fact, we have not been represented in medical illustrations. And there's a long history of that dating back centuries. So I'm absolutely thrilled that this young man created a discussion and these illustrations, these beautiful illustrations.
I had the same impression. I was like, why is this so unique? Why is it so novel? Why are people responding in the way that they were? Then I started thinking about it like, well, I don't know. Maybe I haven't seen Black folks, in medical illustrations. I started thinking about my doctor's office and those, they have those posters on the wall. I started thinking about the few times I've been in a hospital and they show you those videos for patient care. And I really couldn't think of seeing many Black images in any of those depictions. How is it in 2022, we're having this discussion and the medical illustration profession it's a small profession. I read somewhere it's only about 2,000 of these medical illustrators, but it's predominantly white, predominantly male, and they are producing images that reflect who they are. How is that possible in this day?
It's possible because they have literally inherited a cultural tradition and practice that has always centered whiteness. From the 1500s, I teach a class on the history of Western medical thought. From the 1500s, you had men like the Italian medical illustrator and Dr. Andreas Vesalius, creating these beautiful medical illustration books, but everybody was white, right? And so one would think when you move from the 1500s to the 21st century, we would have addressed this misrepresentation because most of the world is comprised of people who are not white. And yet we continue to see this reproduction of whiteness and maleness. And so there needed to be, I think, a Black person to just insert themselves, not ask for permission, but to insert themselves into this conversation to show that we must do better in terms of diverse representation.
So I know you teach a course on medical history, as you just stated. So tell us what's taught to medical students. If you're in a traditional medical school in the United States, you're getting these textbooks, and now maybe it's online. But what are you seeing in as it relates to images in those textbooks?
It's interesting because what you're seeing is essentially white people's images, because that has become the quote unquote universal standard. Although we know that the global population is not comprised of just white people. And so I think there's not really a direct and explicit conversation around representation in images. And what I have seen, and I'm thankful for this conversation, particularly I study the history of gynecology. And when you look at those 19th century textbooks where they're talking about doing experimental surgeries on Black women, often you see white women in place of Black women in the illustrations. So this is really—
Slow down. Say that again. Wait a minute. In a textbook talking about surgeries on Black women, the images are of white women?
White women. So there has been a long history of erasure. And so it becomes the norm. So when you and I have this reaction, like, wait, I thought, because we're Black women, I thought they'd be more. But when we go into the offices, almost all of the illustrations are of white people, right? Because there's always been this historical erasure of Black bodies, of non-white bodies. And so it's high time that we address this, right?
Yeah. Okay. So I'm not going to, make an excuse for those folks who are making those books in the 15th century or the 19th century. Mm-hmm. But I read an article that said even today, like recently as 2020, 2021, that images related to COVID-19, even though we know COVID disproportionately impacted, people of color got sicker, more sick, who died, had higher death rates. But even some of the images around COVID were still predominantly, not some of the images, most of the images are predominantly white. So help us understand how today, like I said, we can talk about why that was, decades ago, but the folks today are supposed to be more conscious, more aware, more woke, so that's what I'm having a hard time wrapping my brain around, because we know better. So we should be doing better.
Know better, we should be doing better. And yet the practice remains the same. I always call it this form of cognizant dissonance. You can know a thing, but the practice replicates what you've already been given, what the inheritance is. And so in the United States, the inheritance has always been about the centering of white people. So even if you know the stats, just as you've recounted them to us, we know the history, and yet people continue to be put in positions, right? And that goes to gatekeeping. The gatekeepers are put in positions to continue to replicate a shrinking population, in all honesty. And that's where we have to have these kinds of conversations to demand realistic representation.
But are these conversations happening? Are they happening in medical schools across the country? Are they happening in departments like yours where, students are being taught the history of medicine?
No, you know what? They are not. They happen when Black people bring them to the fore. And that's real. They are happening with activists. They are happening with Black medical workers. They are happening with this young man who is a medical illustrator and aspiring neurosurgeon. So it's happening when Black people on the ground and from the community are saying these conversations must be placed as central to medical education and representation. Because every medical school is now saying, we support DEI, right? We are about equity and inclusion, except you're silent, or you're not even thinking about the ways that people open up a book and don't see themselves.
Yeah. So the flip side of that conversation is, the activists, as you said, people on the ground are bringing the conversation forward. How are these conversations being received by the gatekeepers, by the powers that be? Are you starting to see any change, any effort to recruit more Black, illustrators, to put more pressure on this closed group of, 2,000 predominantly white males to make their illustrations more diverse?
Systematically, I have not seen anything happening. I think this kind of response to this young man's illustration might be a way for these illustrators to recognize there has to be some pipeline that's created. The thing is, we know Black folk can draw. Black people are artists. We have a long tradition of that. And so how do we get Black medical illustrators into this guild that has been closed off for so long? And so, I think this is the moment for us to start placing demands on these organizations, and also our organizations to continue to beat the drum, so to speak, about inclusion and what that means.
So let's talk about the impact of this. So we know why it exists. We know, the very small steps that are being taken to correct it. But let's talk about the significant impact that it has on these medical students who are, being taught this material, but also on, individual patients who are going into these medical facilities and these, hospitals, having to see these predominantly white images.
I think the impact can be measured in a broad sense. Black people respond positively when we see ourselves depicted in either realistically or beautifully illustrated. And so whether one thinks about film, Black people, we came to the Black Panther premiere because we saw ourselves even in a fictionalized alternative universe. When the Smithsonian opened up its African American Cultural and History Museum, Black people flocked that museum in throngs because there was a representation of their history and their culture. And the same thing applies here. You are going to find people more interested in a career that they might not have known about, or they think, my goodness, I'm interested in drawing. I have training in this. I wonder how I can get involved in medical illustration. And so what I think it does is it opens up a new way of thinking about the ways that we can include ourselves, or, or create our own organizations around medical illustration.
But do these images, Dr. Cooper Owens, perpetuate this kind of cycle of implicit bias that we know is so prevalent in the medical community?
Yeah, yes, all of us. We are socialized to see whiteness as the standard. When we use bandages, it's ridiculous that, it takes the late 20th century and the 21st century for people with brown skin to have a major company come up with brown bandages. Just those kinds of things. The norm has always been about whiteness, although you have a population now, when we think about Black and Latino people, that are about 30%, 25 to 30%. And so that's a substantial number of the American population who are not white folk, who are quote unquote people of color. And yet, we're still having these kinds of conversations that shows the real hypocrisy around representation. People know we exist. We have been here for centuries. And so we are now demanding that our educational sources reflect that in every area.
Yeah, I want to bring into the conversation our mutual friend, Kimberly Seals-Allers. She's an award-winning journalist. She's author of The Big Letdown: How Medicine, Big Business, and Feminism Undermine Breastfeeding. She is also nation's leading maternal health advocate. Good morning, Kimberly, and welcome back. Thank you so much for joining us.
Thanks for having me.
What were your thoughts when you saw this Black fetus? You work in maternal health care. You work with moms before they become moms and after they become moms. So what were your initial reactions?
Well, first of all, as Dr. Cooper Owens said, it was, you kind of like, wait, I'm surprised that this is a thing, but then immediately you're like, of course this is a thing. And it's been really interesting listening to what Dr. Cooper Owens was saying. We've seen this across the spectrum in terms of the ways, particularly in maternal health, that this has been damaging. For example, breastfeeding, right? Come to find out, there weren't even images of Black women's breasts that were being used in lactation science and lactation books. And so again, to Dr. Cooper Owens' point, an amazing Black lactation consultant in IBCLC, Nikisha Killings, created the Melanated Mammary Atlas as a way to show pictures of Black and brown breasts, because this field was not able to diagnose very common conditions. And we know also how important breastfeeding is to our community as well as to maternal infant health. So this lack of representation has had many repercussions and damages, not just in medical doctors, not just in the Black people not seeing themselves, but providers doctors being unable to properly diagnose us because they don't know what things look like on our skin, right? The rashes look different. In breastfeeding, mastitis can look different. So many things. And when we're not included in the education, how do we expect to receive fair care when things as simple as our skin tone are not being factored into the educational process?
Yeah, that is such an important point when you think about like breastfeeding, having breastfed 3 children myself, and you think about all the changes that your breasts go through, the visual changes that occur. A doctor that hasn't seen those visual changes in darker skin could definitely miss something really big. Dr. Cooper Owens, tell us, like, what has been the history of how breastfeeding is taught between Black women and white women? I mean, has there been, huge differences in how we've even thought about breastfeeding?
It hasn't necessarily been taught as a thing, right? What we do know in terms of the images that have been problematic, historically, I think many of us have seen these really jarring and striking images of Black women breastfeeding white children. But we see those kinds of images, right, that depict inferior status, that depict Black women as reproductive laborers, But in terms of, as Kimberly has said, in terms of the medical education, it's just not been there. Once again, this historical erasure of Black women as breastfeeders, as providers. So if your skin is very dark, we know there are gradations. I mean, I can look at all of the beautiful brown faces here. There are gradations of our hues. And so once again, how do you know if a breast is experiencing a certain condition, rash, allergic reaction? Because you might not have a red rash, right? If your skin is very, very Black and very brown. And so those are the kinds of things that are not being attended to. Mm-hmm. And once again, it brings up this issue of not just diverse representation, realistic representation. And it becomes really critical when we are thinking about a Black maternal and birthing crisis, where we should know all that we can about Black mothers and Black birthing people.
Yeah, thank you for segueing into that, because Kimberly, every time I have you on, I want you to tell us these horrific, statistics, because I don't think enough people know them. I don't think we talk about them nearly enough. And clearly we're not working fast enough to address the Black maternal health crisis. So, tell us what this crisis looks like and why these images, how these images play into this crisis.
Yeah, well, this crisis in our country looks like the CDC saying that Black women are 243% more likely to die from a pregnancy or childbirth-related complication, right? And the majority of these deaths are
243%
more likely, yes. And many of these deaths are preventable, right? And that's really the worst part. We see across different states where the disparities are even deeper. In New York City, where I live, Black women are up to 12 times more likely to die than white women during pregnancy or childbirth. And so we see these disparities across the board. They've existed for years. And even across the breastfeeding spectrum, Black women have disproportionately not breastfed at the same rates for over 40 years. And when we think about how that duration of breastfeeding impacts health, we know that breastfeeding has benefits to the mother too. And so the whole maternal health landscape is being affected both on the pregnancy and childbirth side, as well as the infant feeding side, by this history of systemic racism, where Black women were viewed as breeders and feeders, but not as intentional nurturing children, mothers of their own children. And those stereotypes and the lack of including us from medical education to all sorts of things has now had serious repercussions that allow us not to just be erased in medical textbooks, but ignored and basically invisible when we're literally there in person seeking care, right? And this is what we're seeing play out. We see a lot in the Earth App reviews, this idea of Black women not being seen and heard and valued is not just about textbooks. It is about the lived experience. And that is the piece that we have to address, because, to have the picture in the textbook, as much as we want that, but not still be seen when we're literally in your office needing care, is still not the goal. So we can't let the idea around the visual reputation often distort and supersede what we need in terms of being actually seen when we are literally right in front of you.
Yeah. So thank you for plugging the Earth app. It's a phenomenal app that Kimberly created, which gives Black women and medical providers an opportunity to post their experiences, to share those experiences. So if you don't have it, make sure you go to the App Store and download it. But you mentioned how Black women are dying. What are the three top causes that that has been documented in terms of deaths of Black women in childbirth?
Well, if we talk about from the big picture, we know that racism and bias is at the root, right? This idea that people are having preventable deaths, and that's the part we have to remember. So we look at many of these high profile cases, the ones that have been often in the media and in headlines. It is not that they had a medical condition that necessarily necessitated that they may not live. It was that they were there and they were not, they were ignored, they were not listened to, they did not receive the care that they needed, and they died. But what I do want to say,
what are they dying from? Are they dying from like internal bleeding or heart attacks? Like, do we know medically what causes Black women to die in childbirth?
Yes. And so I want to make the linkage to the part of the reason why we're dying disproportionately more is because of how we're giving birth. So Black women are also more likely to have a C-section. Now, the C-section rate is often ridiculous and also something where you see a racial disparity because a C-section doesn't allow you to have freedom and control and birth your baby with your body. It actually centers the medical provider by making you prone and knocked out, and they get to surgically remove your baby when we know that birth is not necessarily a surgical event, right? And so we have to get to the root of understanding the way the racism has caused us to have a higher C-section rate. And then when we have these C-sections, we often have complications such as hemorrhaging. Many people may have high blood pressure, preeclampsia as pre-existing conditions. But we have to remember that all of the white women have preeclampsia too. Right? And so we can't center the fact that we are disproportionately dying just around the condition. It's the care that we're receiving or the lack of care, the substandard care that we're receiving when we have many of the same complications that white women have. White women are obese, white women have high blood pressure, white women have diabetes, and many more of them can successfully have a pregnancy and childbirth and live to tell the story, right? That's all we want. That's all we want.
Yeah, no, that's profound. Yes, white women have the same pre-existing medical conditions that Black women have when they go into the hospital to give birth, but yet the outcomes are so dramatically different. Dr. Cooper Owens, what do you hope this conversation leads us to in terms of systemic change? I mean, we're in this moment, we're going on 3 years now, but at least the last 2 years since George Floyd was murdered, talking about how we dismantle systemic racism and these structural biases. How do we do that in this medical profession, which is so rooted in whiteness and white superiority?
Right. So I think something that is promising for me is that the CDC finally in April 2021 declared racism as a public health issue. And a Black Surgeon General in the 1990s, David Satcher, was saying, hey, y'all, look at these health disparities, and Black folk are getting the short end of the stick. We need to dismantle medical racism in a 10-year period. That didn't happen. It took several decades, but at least there was a recognition that we are not playing some quote unquote race card, right? That the stats don't lie in this respect. We also need to recognize that this is, just as Kimberly stated so eloquently, this is systemic. This is structural. When I tell people about the father of the American C-section, first learned his craft on the bodies of enslaved pregnant women in Haiti and also in Louisiana, and that until the 21st century, Mississippi is now number one, but until the 21st century, Louisiana relied the most heavily on using Black women's bodies in C-sections. That is something that is an unbroken thread. And Mississippi, which was the richest slave state in the Union until the Civil War, is now number one in its disproportionate use of Black women in C-sections.
And are they doing that, Dr. Cooper Owens, because there's some monetary incentive for hospitals to perform a C-section versus having you go through natural labor?
Yes, it's tied up with money, the kind of big business of C-sections now, but it's also tied up in that belief, that many people are aware of now, that Black women don't really experience pain around childbirth in the same ways. So surgeries can be done on them, and the expectation is somehow the bodies are stronger. This is a surgical technique for something that is a natural biological function, and there is a disproportionate use. So I think structurally, we have to come at it with changing these policies. And I have advocated, applying something that is punitive to doctors and hospitals who are continuing to get really bad ratings around Black maternal morbidity, mortality, Black infant mortality and morbidity. Something has to be done. Licenses lost, these hospitals not receiving the funding that they need if they are continuing to place Black women and their babies and Black birthing people at peril.
Accountability is what you're talking about, right? People being held accountable. Kimberly, so Dr. Cooper Owens says, money obviously is driving some of this, but is there also just like an impatience in the medical profession where doctors don't want to, go through 13 hours of labor, watching a woman, in pain, pushing out a baby? Has something changed in the profession around that?
Well, here's the most important part. Birth hasn't changed, right? So the process of birth has not changed. So perhaps providers have changed in their expectations. We certainly know our healthcare system is broken. And so maybe there is some sort of incentive to do more. Right now, we're on a volume basis for people to earn money. But birth in itself has not changed. And so how do we honor what birth is and not try to break it to the harm of disproportionate Black women for the sake of what we know are commercial interests and the money? We do have a commercialized healthcare system, and that requires more accountability. That's something certainly we're trying to do with our Earth app reviews, using them on the back end, working with hospitals, showing them what's important to Black people, showing them how they can improve their care. But the system cannot change the birth process, but it wants to make it worse and actually unsafe, and that's not okay. And so, of all the ways that we need to consider how we can, how doctors may be changing, maybe they have more, they have to take on more patients, perhaps they want more time, but you can't kill Black women in the process. That's not a solution that anybody's here for.
Yeah, and just briefly, Kimberly, in your book, part of the title of your book, The Big Letdown, is how big business undermines breastfeeding. Help us understand how big business is involved even with respect to breastfeeding.
Well, when we think about it, there's lots of money to be made across the food spectrum, and it starts with your very first meal, right? And when we've seen the money that infant formula companies have paid hospitals just for the right to influence that decision around that first food, that first meal, it is really mind-blowing, right? And what we understand is like there is something uniquely a food that women, lactating people with lactation plumbing create. And the idea that there is a commercial industry designed to to encourage you not to do that or do it less. And that's when money is made. Money is only made when breastfeeding fails. And so there's been a lot of money put into the failure of breastfeeding that unfortunately too many women have internalized and taken personally and suffered with without understanding that many of us were set up to fail before we even started because of the money being put into making sure that breastfeeding is difficult, making sure that hospital has been paid to offer you formula, making sure those doctors and nurses have often gone to conferences sponsored and paid for by these same companies that now want to influence your infant feeding decisions. There's a whole big money wheel, and I talk about it in the book, but people think it's just about choice. I'm like, well, you really don't have true choice when someone literally spent billions of dollars to influence you.
Yeah, I'm sitting here thinking, like lying in the bed after you've had a baby, you're exhausted, you're tired, and yes, they start pushing formula on you. And as an exhausted person that's just gone through this process, it's very easy to just say, okay, that sounds reasonable. Or you grew up and you saw other, families using formula, and you haven't seen a lot of Black women breastfeeding. It can feel like the only choice. And definitely the right choice to make in that time. I want to thank you so much, Kimberly. Always a pleasure to see you. Thank you, Dr. Cooper Owens. Always great to have your insight. Such an important issue. I hope, as you said, that the CDC declaring, racism as a public health crisis, that is the beginning of, some change that is so needed. And again, kudos to that Nigerian illustrator, future, as you said, neurosurgeon, for causing us to have this long overdue discussion and hopefully just the beginning of a discussion that will lead to some real systemic changes. But thanks to both of you for your voices on this topic.
Thank you.
All right. Now I want to bring on some nurses, because you can't talk about patient care and what's happening in hospitals and medical centers without talking about nurses. They are essential to patient care. So joining me now is Dr. Daihnia Dunkley. She is a lecturer at the Yale School of Nursing, and Dr. Tiffany Montgomery. She is a professor at Temple University in their Department of Public Health and Nursing. Good morning, Dr. Dunkley and Dr. Montgomery. You both have been listening to the conversation. I just want to get your initial impressions when you saw that Black fetus. Dr. Dunkley, were you shocked? Were you surprised? Like, what emotions did you experience?
I was actually in between emotions. And then initially I said, have I seen this before? Like, I started to question myself. This can't be the first time that I'm seeing this.
All of our
Yeah, I started to question my own self. Like, I had to have seen this before. And then I realized, no, I haven't. In all of my years of nursing training, and this was quite novel, and I can understand why it had the impact that it did.
Yeah. What about you, Dr. Montgomery? What impression did you have when you saw the Black fetus?
Well, I saw it first on LinkedIn, and I was extremely happy to see it because I am a labor and delivery nurse, or I was before I quote unquote retired. And in 15 years of working at the bedside as a labor and delivery nurse, I did not see images of people who looked like me in textbooks or otherwise. In fact, every labor and delivery nurse in the United States, and probably in many places around the world, can tell you who Noelle is. Noelle is our mannequin who actually does give birth. And this is something that we practice our obstetrical emergencies on. Many schools of nursing have a Noelle doll, or not doll, but mannequin, and she's white. I have never seen a Black Noelle doll or mannequin. And that's shocking when you really sit down and think about it.
I just want to be clear. That's the mannequin that if you're in a nursing program, everybody's going to get to work on or have some experience with Noelle, the white mannequin that gives birth.
Her name is Noelle, and she gives birth. And this is, again, what we practice our obstetric emergencies on when we do scenarios and case studies and things, so that we can be prepared when the real deal happens. And we practice on Noelle, a white mannequin.
Wow. Dr. Dunkley, seemingly something is happening in nursing. Definitely since COVID, we hear these numbers of we hear these statistics, large numbers of nursing practitioners are leaving the field. What's going on with nursing? Are some of these issues we're talking about today, these systemic racial issues, is that impacting the field of nursing?
I have to say that absolutely should be considered in terms of reasons why nurses are leaving the profession. One, obviously there's burnout, just being physically burned out from the overwhelming impact of the COVID-19 pandemic. However, there are psychosocial issues that go on in workplace cultures that also impact nursing satisfaction and their desire to stay within the profession. And we cannot ignore some of the huge traumatic events that have happened during this time, where we've had this reckoning with social justice and a huge national medical pandemic. So absolutely, that has to play a role.
Yeah. And Dr. Montgomery, so go back to Noelle for a minute. If you're taught in nursing school to work on Noelle, what did you see with your white peers when they were in those emergency rooms or in those delivery rooms delivering babies or helping to deliver babies from Black women? Were they prepared? Did they recognize, whatever issues that might not have been, taught when using Noelle?
So I think a lot of times what happens is an issue of implicit bias, right? You don't think that this is the case, but what happens is you begin to see white people birthing as normal. You see that as the norm. And then when someone else comes in, a Black person or a Hispanic, Latina person, you don't necessarily view that as normal. But the fact of the matter is, in order to have a baby, your body has to be working pretty normally in order for you to get pregnant, maintain that pregnancy, and then be able to give birth. birth is not a medical issue, right? Most people are in the hospital because something is wrong. That's not what's happening with childbirth. But when you only see images and when you only do your scenarios on white mannequins and you only see images of white people in textbooks, it makes you believe that it is the norm for white folks to go through this process, but not necessarily for others.
Yeah, no, that's a really interesting point. And Dr. Dunkley, even beyond childbirth, what impact have you seen, providing patient care when you were, doing direct care? How are these images and the centering of whiteness in the medicine, the medical profession? What does it look like on a day-to-day basis for your Black patients?
Oh, sure. This whole concept, thank you, Dr. Montgomery, for bringing up that concept of othering, right? So when you are inundated with images of white being the norm, right? Everybody else becomes the other, right? And so you hear the comments and the stereotypes and the biases, right? They automatically assume certain things about other minorities when they come in, when they present as patients. Maybe they're uninsured, undereducated, they don't, they're not your ideal patient because of this sense of othering. And so that's how you see the disparities in care. You see Black women being ignored, as Kim said earlier, their pain threshold, right? They're not as medicated for pain, right? Because of these stereotypes that we've bought into because we are considered as other.
Yeah, we know, Dr. Montgomery, that myth of Black women having a higher threshold for pain has, it's been around for a long time. It's still a very pervasive myth. What are some of the other myths that folks have about Black patients that we need to debunk? That the medical profession, still harbors around Black people, when they are ill.
Well, a lot of these myths come from, I think, the fact that we don't see Black people a lot in the media, and we become, we have internalized racism that goes on. A report just came out recently from the National Commission to Address Racism on Nursing, and I found it interesting, but not so much, that while 7 out of 10 Black nurses said that they believe there's a lot of issues with racism in nursing, only 3 out of 10 white nurses said the same thing. One of the reasons this is an issue is because 75% of nurses are white. So we have 3 out of 4 nurses who are white, and only 3 in 10 of them believe the same thing that 7 in 10 Black nurses believe. This is a problem. When you live in a city like I do, like Philadelphia, and you have a population that's more than 40% Black, but you have a population of health providers that has a much lower number of minoritized people, it just gets out of control. I did a quick study last year and wrote an op-ed on the fact that only 6% of the faculty at nursing schools in Philadelphia are Black, but 40% of our residents are. That's an issue because the people who are teaching, the nurses of tomorrow, the people who are providing care in the hospitals in our city don't look like the residents. And a lot of times there are internalized issues that they won't even acknowledge that prevent them from giving optimal care.
I want to go back to that shocking statistic. 75% of all nurses are white. It's so funny because I live in Los Angeles, and I remember reading articles in LA about this big push for, Asian nurses, particularly nurses from the Philippines. And when you go to hospitals and medical facilities in the Los Angeles area, you definitely don't see a lot of Black nurses. So that doesn't surprise me, but you do see a lot of Asian nurses. So is that just, the way LA is skewed, that's not obviously representative of, nurses across this country?
It's not. There are some hospitals where you won't find a nurse. I worked in a hospital for just about a year in San Jose, which is a very diverse area if you look at the census and statistics. I was the only Black nurse in our labor and delivery department with among probably 90 other staff members. the one and only Black nurse. And so it happens. You see pockets of the country where there are more, Hispanic nurses or more Asian nurses or more Black nurses, but overall, only 70 or 75% of nurses are white. And it gets worse when you think about advanced practice nurses. 86% of advanced practice nurses, your nurse practitioners, your nurse anesthetists, your certified nurse midwives, your clinical nurse specialists are white.
Yeah, I'm proud to say that I have a brother who's in Boston. Now he's in Illinois. He's a nurse anesthetist. He has his master's in nursing and maybe even another advanced nursing degree. And he's a Black man. And totally, that number is probably even smaller when you think about Black male nurses who are in advanced nursing care. Dr. Dunkley, why so few Black nurses? It's such a great profession. Well, it pays well. You're loved. You're not like cops. Everybody hates police officers. Everybody loves nurses and firemen. So why so few Black nurses?
That's a great question. And there are a few answers, right? I believe that representation is everything. And just like Dr. Montgomery mentioned, is that you don't see the representation in nursing because the majority is white. And how do we begin to change that? Right. So we have to make it attractive to younger people. We have to increase the representation from the beginning of the pipeline. So beginning to expose youth to medical professions and showing them that it is possible for you to get into a career like this. There are other issues as well in terms of the financial commitment. Sometimes being able to afford, nursing school is expensive, and also when they get into the classrooms, how are they being nurtured? How are they being treated, as individuals? Many times you walk into a classroom and of course, because of the underrepresentation, you may be one of few or the only Black student. So maintaining students in programs of nursing is also something that is incumbent upon us to make sure that they go through the program, they finish, and they feel like they belong, right? So that culture of inclusivity. And when they graduate and get to the bedside, right? What does the workplace culture look like? Are they seeing representation of themselves at the bedside and through positions of leadership? So we have to recruit more, right, to be able to sustain and maintain them in these programs and then push them out into the workforce and be able to maintain them there as well.
I had an opportunity, I guess it was 2018 or 19, right before COVID, to give the keynote address at Charles R. Drew Medical School here in Los Angeles. And they have a fantastic nursing program, and the student body is incredibly diverse. They have undergraduate programs, and obviously, they have a medical school, but they have a really large nursing program. And as I sat on the stage and just watched the number of diverse students who were graduating with their nursing degrees and some with their master's and other advanced degrees, was really, empowering for me to see that many Black and brown, primarily women, but there were some men, in the medical profession. Dr. Montgomery, I want to ask you, you're a Black patient, whether you're in Philadelphia, Boston, Detroit, Los Angeles, and you go into one of these medical facilities and you don't see any Black nurses, maybe don't even see any Black doctors. How do you talk to your healthcare provider, to find out if they really are able to treat you? I'm thinking about my daughter. She fell and injured her face, and she, had to have some laser treatment. And she spent a lot of time looking for a dermatologist who could treat, her brown skin, because she was concerned about scarring. And, she talked to a lot of folks, and a lot of those doctors in their offices said that they didn't have a, predominantly Black patient base. And it took her a while to find a dermatologist that she felt that could treat, her skin properly, and, it turned out fine after, several treatments. But if you go into one of these facilities like you just described in San Jose and you don't see anyone who looks like you, what questions should you be asking those medical providers?
That's a really good question. I mean, it's hard because a lot of people don't have a health background themselves, certainly not a medical background, or may not have anyone who has that background. But if you can take someone else with you, because sometimes you might not always know the questions to ask. If you know someone else who's a little bit more knowledgeable of the healthcare system and can help you navigate that a little better, that can be one thing that you can do. Also, just making sure that you reach out to nurse navigators that some hospitals and healthcare corporations have. Some insurance companies also have nurse navigators who can help you know what questions you should be asking. One of the things I do whenever I move to a new city or I get a new insurance, I go on the website and look to see where are the African-American providers, where are providers who look like me, who went to schools that I know of, who had possible lived experiences that are the same as mine, who I can relate to. And those are the people that I reach out to. Unfortunately, they can be few and far between, but hopefully that will change.
That's great advice. And just lastly, Dr. Dunkley, what's being done to address this implicit bias? Are nurses required to go through some kind of diversity and equity training or implicit bias training? And is it enough? I know I was doing some research on implicit bias in the medical profession, and one of the companies said that a lot of hospitals just kind of check the box. You take an hour or two, online, and you're now certified as having gone through diversity training. Hopefully it's more robust than that. I hope that's your answer.
Well, I don't have that answer for you. I can tell you that the majority of these programs it depends on the hospital that you work at. It depends on where you are, and how much training you receive is based on also a difference in where you're located and which employer you have. But I can tell you that in nursing schools, right, in programs of nursing, there has been a huge push to start to educate from the very beginning, right, of the nursing process, and teach nursing students that the cultures that you're going to be working with are very diverse and maybe different from anyone you've ever worked with before, and teaching them what implicit bias is, teaching them about structural racism, right? And teaching them to debunk these biases and myths about the physical differences, because we know that there are no biological differences with race. And so I think approaching it from the beginning of the process will help what we're seeing at the bedside. But definitely, I think that hospitals have to do a better job of infusing these messages throughout the nurses' careers. It can't just be a checkbox and be done with it. This is a dynamic issue it gets messy, and uncomfortable conversations need to happen. It can't just be a one-time workshop, right? So yeah, I'm sorry, I don't have that well-packaged answer.
No, I think that is the answer, that it is an uncomfortable conversation, can't just be a check the box, can't be a one-time conversation. And Noelle needs a friend. Now, that's that Noelle is still the mannequin that's being used in nursing schools throughout this country. She needs a Tiffany, a Shaniqua, a Shakita, somebody, to roll with her, because it is not acceptable that a white mannequin is the, prototype for nurses, when we know, as Dr. Cooper Owens said, the majority of this population is already, minority, and if not, we definitely will be in the United States. And to still be using white mannequins in nursing schools around this country, and some of these are probably some of the most prestigious schools, supposed to be liberal-leaning schools, they need to do better. They know that's ridiculous. Come on, Yale. Come on, Harvard. Come on, UCLA. Y'all can do better than that. Tempo. So,
I'm going to say that
roll on this.
I'm going to say that we do have very diverse mannequins. So kudos to Yale for that.
All right, Yale. All right. Well, does Yale have a friend for Noelle?
Yes, we have multiple different representation of different groups, older adults, children. So, but that's part of the issue too, is that, a well-resourced school can afford to purchase the diverse mannequins. We need to be able to have this funding poured into the schools that sometimes are the ones in the neighborhoods that educate our Black and Brown nursing students.
Right. No, great point. Thank you so much, Dr. Montgomery, Dr. Dunkley. I hope this conversation has inspired someone who's sitting out there who loves taking care of people, who, loves being involved in saving folks and making people smile will consider nursing. And there are programs out there, I would imagine, that provide financial aid and financial support for those who want to pursue a career. It is such an honorable career, and we so appreciate nurses, particularly over the last 2 years. We've gotten to know how incredibly important you all are to our, the health of this nation, really. And all those folks who are fighting you in hospitals because they won't get vaccinated. I'm sorry, it's not me, but I'm just going to apologize for all those people, because you guys deserve to be loved and not, fought with and attacked because you're doing your jobs. But again, thank you so much for joining me this morning. All right. We've been talking about the U.S. Now we're going to talk about globally what's happening around this diversity issue, because this isn't just a U.S. problem. My next guest is Dr. Theresa Larkin. She is a senior lecturer at the Graduate School of Medicine at the University of Wollongong. I think I got it right. Wollongong in Australia. Good morning, Dr. Larkin.
Good morning. How is everybody?
Good. What can you just pronounce that university for me? I just want to hear.
It's so funny. No one in the States can ever say that one. It's called Wollongong. Actually, it's the only university in Australia to have an Indigenous name, which is lovely.
Okay, well, fantastic. I know you did a study recently where you looked at bias in the medical profession, not just racial bias, but also gender bias, particularly in a anatomy textbook. So tell us what you found from this study.
Yeah, that's right. So building on from what everyone's spoken about, which has been amazing, my first PhD student was really interested in bias and how the image perpetuates that bias. So she thought best in medical education and healthcare to go straight to the beginning and to have a look at anatomy textbooks, because that's where we see a lot of images, and images in textbooks can be quite authoritative. So they set the scene and people trust those. So for her first study of her PhD, she analysed 17 textbooks that are predominantly used in Australian medical schools, but I know that they're also the same, a lot of them are the same textbooks that are used globally and in the United States. She analysed 7,000 images and found that the vast majority were male. So in some textbooks, there was a ratio of males being represented 4 times more than females. But she also found that white people were in 78% of images. So 78% of images were of white-skinned people. And so I guess that brings up also the problem of intersectionality. So, the majority of the images depicted white, healthy, muscular males. And so, females are less represented, but Black women were much less represented. And so, she looked at that and really found that there were some huge disparities in what is being presented at that base level.
Wow. And did she go further in terms of that study, in terms of what the impact of those 78% white, predominantly male, like what impact are those images having on the medical profession?
Yeah, she did. So she did 2 more studies. One of them, she actually had contacted the Medical Illustrators Association, and she had medical illustrators write in and complete a survey and talk about where they got their references from and what influenced their decision making in terms of the illustrations. And interestingly, from what the others have said as well, it's perpetuation. Most of the previous images were of white people, so they perpetuated those and drew them off the white images. So this image of the Black fetus is amazing that this can start, a whole new area, just increase those images. But we did a 3rd study, and that was looking at how students actually responded to seeing either gender biased or neutral images. And we have no doubt that this can extend to looking at, predominantly white versus predominantly Black images. And so students were given either a series of neutral images or a series of gender biased images. And then after that, they completed a survey to examine their explicit biases. And there was actually no impact on explicit biases. But as we know, we can frame those how we want. We can answer a question, do you think this is the case? And do it as we want. But we also did a test of implicit bias, and that was directly significantly affected. So the students who had seen those gender biased images, they had a higher implicit bias in terms of gender roles. So this can really follow through. And that was students in their first year. But this continues. We only looked at anatomy textbooks, but it would be interesting to look through obs and gynae, surgery textbooks, because that bias, if it continues through, then that becomes the norm. And so we really need to affect that systemic change from as early on as we can.
So, Professor Larkin, tell us how that implicit bias that was, recorded in the study plays out in the real world. Can you give us some examples?
Yeah, so I guess it's what, when people are used to seeing certain things, they normalize that. And so if we don't have representation, then people who are going on to become medical and health practitioners, they can have these narrow views. So I guess one of the interesting things is then in terms of, when you see someone, like everyone has said, and made a judgment. So it can also affect people's decisions on what they do for their own career choices, obviously, and that includes within medicine and healthcare. So we also need representation on the ground level. So not just seeing that in the textbooks.
But are there any examples, though, of how that implicit bias that a healthcare professional may have will impact how they provide care? Like, they will see a person of color, a female person of color, and make a medical diagnosis that's different than a diagnosis that they may make if the person is a white male patient. Is that how it plays out on the ground level?
I think that, and also in treatment and interaction and diagnosis, and even if we think to the to skin color and skin function itself, the only difference between someone with white versus black skin is the melanin content in that skin. So as Dr. Dunkley said, the biological difference, there are no biological differences. But what that means, we have sort of twofold issues there. So the increased melanin in someone with black skin, that's protective of skin cancer, but it also reduces vitamin D production. So if we haven't got these awarenesses about how things like that manifest, and then that's where it's really important to see images and to see patients and to have mannequins, that have diverse, skin color, is that then the presentation of, say, skin cancer or a skin disease on the skin, that could be missed, or it could just be even before the level of diagnosis and looking, it could be the perception, someone with black skin is not going to get skin cancer. But that's
what I'm thinking as you're saying that, I remember, as a kid growing up, the myth was that if you were black, you didn't need to wear sunscreen because black people didn't get suntanned or sunburned. And a lot of African-American folks believe that they could go to the sun without suntan, whereas, my white friends growing up were fastidious about never going out into the sun, without lots of sunscreen, hats, glasses, protective wear. So that's
right.
A good example, I think.
There is no, complete UV resistant skin. Any skin color can have damage. So we need the awareness about that. But the other thing, linking in with what other people have said, even recently, a study of medical students showed that many students believed that black skin is thicker than white skin. And that is not true at all. But that could definitely...
Right? Thicker, like the texture is thicker.
Yeah, and that's a myth that could lead to people going along with the assumptions that have existed about black women having a higher pain threshold. Or imagine if, a medical practitioner thought that the skin, or thinking about cesarean section, I was really sad to hear that there's a higher rate of cesarean sections among black women in the States. But yeah, there are impacts like that just in terms of the myths and not really appreciating the differences, but also understanding the similarities.
I'm just curious, what would thicker skin mean? Like you did have thicker skin as a black person. What would that mean? That your skin wouldn't puncture, you wouldn't bleed? Like, just what?
I assume that's what people think. It's funny because even when we talk about the skin, we're only talking about a few millimeters. So, our skin thickness varies based on the part of our body, but certainly not between someone with white versus black skin. So, but it's one of those things that, we have a perpetuation, and that's what the research that my student did was really looking at, what is out there. That when Rhiannon did her study, there had not been a study for 20 years looking at the representation across anatomical textbooks. Wow. So, I think that things will change bit by bit, and obviously that's great that, the more conversations are had and the more awareness that's raised. And I always hope that, the students that we teach will start to do things differently, and that in their medical practices, they will have posters around the walls that are welcoming to Black people, people who have who are intersex, people with disabilities, so that we can have this increased representation in healthcare, because it's the only way that we can get maximal healthcare for everybody.
So well said. Thank you so much, Dr. Larkin, for your PhD students, for the work that they did, these studies. Like you said, one hadn't been done in 20 years on these textbooks. So definitely long overdue study, great findings. I hope that these findings will fuel the kinds of changes that we've been talking about that are needed so that people of all races are receiving the best medical care. Thank you for joining us again, though, this morning.
Thank you very much.
Wow, I want to thank all of my amazing guests this morning. All had so much great information to share. Some of those statistics are startling, like the birth death rates or the death rates of Black women in childbirth. Every time I hear that, 246% more likely to die, that number is so big and so mind-boggling. I don't think we can talk about it enough. And then the next question is, what are we doing to change that number? And then to hear that 75% of nurses in this country are white, also very startling and shocking statistic when you think about African Americans being somewhere between 13 and 15% of the population. So that other 25% of non-white nurses, that's not all Black folks. That's going to be Black and Latinx and Asian, and other groups. So I don't know what that 25% breaks down to, but in terms of Black nurses, but clearly we have a shortage of Black nurses. I talked on the other shows about Black lawyers. There are only 2% of Black lawyers in this. 2% of the lawyers in this country are Black women, and we put it that way. So again, woefully underrepresented as Black women in the legal profession, woefully represented in the medical profession, because I think Black doctors, again, make up about 4% of all doctors in this country. So we got a lot of work to do. We got a lot of catch up to do. These are critical roles that people play in our society. The healthcare, there's nothing more important than your health and who takes care of your health. Definitely, we need folks that look like you, because representation matters. Just some words to live by before I get out. You get what you work for, not what you wish for. America, we cannot just keep wishing for an equitable society, a society where race and racism, doesn't exist. We have to work for that society each and every day, and we have to work for it in every institution, from colleges and universities to medical facilities to courtrooms to corporate offices to nonprofits, organizations, and government entities around this country. If we want to see results, we've got to put in the work. All right, y'all, I'm out. Be safe out there. Wear your mask. Don't forget to get your booster shot. And remember, we're all in this together.